to the next slide, please. Concerning the agenda, during this webinar, we will give you an overview of the partnerships landscape. We will present you the call text, including the submission steps and the evaluation criteria. And finally, we will give you a demonstration of our partner search tool in case you wish to search for partners in the future. So at the end of every presentation, we will have a Q&A session, and then we will have a final Q&A session for all the webinar. So if we all agree, we can start recording the webinar, and also we can start with the first presentation on THCS partnership from Federico Bastarolo, who is also part of the coordinating team. So Federico, when you're ready, the floor is yours.
Hello, good afternoon, everyone. I'm Federico Bastarolo from Promise, an affiliated entity of the Italian Ministry of Health, who is the leader of THCS. I will share my screen now as I have prepared a small presentation to introduce to you what is THCS. THCS, that stands for Transforming Health and Care Systems, is a European co-funded partnership under Horizon Europe. Specifically, Horizon Europe Cluster 1 of the second pillar, so Cluster Health. What are European co-funded partnerships? They are initiatives which are partially funded by national and regional funding agencies and the European Commission, which together they pool some money, and through this money they want to fund research and innovation activities in different domains. Specifically to our partnership, we have here a few figures to give you an overall view of who we are. We started in January 2023, and our partnership will last for 7 years. Our partnership is composed by 63 partners in total. 23 are European Union member states, but also we include Horizon Europe associated countries like Israel and United States. On top of that, we include also countries like Switzerland and the United Kingdom. Also, we do not have only member states or national entities as our partners, but we also include regions. In this slide, you can see an overview of how THCS is organized internally. We have 4 pillars. Pillar 0, which is horizontal, that is the program management pillar, and then 3 main stream of works. We have on the left side of your screen, pillar 1, so science and innovation into policy and practice, in which our partners are working to develop methodological and assessment frameworks which will help the replicability and scalability of research and innovation solutions that we have identified across different countries in European Union and beyond. And also we have a work pillar specifically dedicated to bridging evidence into policy, making sure that the results of the research and innovation actions that we are funding will arrive to the desk of policymakers. And by doing so, policymakers will take into account the scientific evidence when deciding public health policies. On the right side of your screen, you're going to see pillar 3, which is another important pillar of THCS, and is the one supporting the transferability and strengthening of ecosystems. In this pillar, we have 2 work packages. Work package 9, which is dedicated to ecosystems, and work package 10, who is developing a knowledge hub in which that will serve as a repository and interactive platform where we are going to upload all the relevant material we are going to produce over the 7 years of our existence. But most importantly for you and for what we are doing here today is Pillar 2, which is our central pillar and our core business. And it's the pillar dealing with research and innovation funding. This pillar, which is managed by 3 work packages, covers the whole life of our calls. So we have work package 6, which works on the call text definition. We have work package 7, which is in charge of the Joint Transnational Call Secretariat, and work package 8, which deals with the project monitoring and the assessment of project results. What is the THCS approach? By having sorry, no, okay, that's fine. By having seen the previous slide, I guess that this one will make more sense, in the sense that our approach is based on the 3 pillars that we have seen reflected in our internal organization. Starting from the center, that it's our overarching objective, that is to deliver research and innovation solutions for a people-centered, sustainable, sustainable health and care systems. We want to do mainly 3 things. We want to fill the knowledge gap, and in this sense, we are funding research and innovation actions to understand and increase our understanding of the problems that affect health and care systems across Europe. We want to implement and transfer these solutions at European level. So that's why we have work packages dedicated to finding suitable frameworks and repositories and platforms where to store this information. And our third main line of work is related to boosting health and care systems. And we are doing so by promoting capacity building activities, strengthening ecosystems, and providing policy updates to policymakers. The outcomes that THCS is expecting at the end of the 7 years are very heterogeneous and are obviously related to what we have said so far. We want to have more researchers at European level engage in collaborative research. We want health and care authorities and policymakers to use the results of these researches and to make sure that these evidences will be reflected in the decision making. We want to help health and care authorities and policymakers also to plan and carry out more efficient investments when it comes to health and care systems. We want stronger regional and local ecosystems, and we want to promote an overall better cooperation among countries in the field of research and innovation in health care. In this slide, you can see an overview of the 3 joint transnational calls that we have funded so far. As said before, this is the core business of THCS. We pool money together from national, regional funding agencies, plus the European Commission. And then our work package 6, it's designing calls for proposals. Our first call for proposal was launched in 2023. The name was Healthcare of the Future. It was a more general and broad topic to support the implementation of innovative solutions on a larger scale. Last year, Joint Transnational Call was titled Innovate to Prevent. And the aim was to support the implementation of innovative person-centered health and care models addressing prevention strategy mostly. This year call, the one for which we are here today, is called Better Care Closer to Home. You're going to hear much more about this later, but just to give you an overview, it's a call aiming to fund research and innovation for projects that strengthen primary and community health and provide policy and decision makers with the necessary knowledge and tools to govern the transition needed in primary and community care sector. If you're interested to know also the impact assessment of our first Joint Transnational Call, the 2023 edition, here on the right side of your screen, you have a QR code which will lead you to the deliverable made by our Work Package 8, which go into details into the impact assessment of Joint Transnational Call 2023. Before moving to the next slide, also just to a note on the funding and number of funders. As you can see, we are always around 30 million euros every year, and also the number of funders is stable around more than 30 funders every year, which pulls money together. We are present obviously on all major social media. You can follow us on LinkedIn or on YouTube, where we have a lot of material, including a video presenting this Joint Transnational Call, and where also the recording of this video, as anticipated before by Maria, will be uploaded and will be available for you to follow the meeting again in case you have questions. Otherwise, you can find more information on our website, and you can always drop us an email in case you have specific questions. So thank you very much. And Maria, the floor is yours again. Thank you.
Thank you. Thank you very much, Federico. I see that Rick Villans would like to ask a question. Hello. Do you have a question concerning this part of the presentation?
Yes, thank you, Maria, and thank you for your introduction. I had a very simple question, which is, you've done these programs before, so can you share a bit about how many proposals were submitted in the previous years and what the percentage of success was for the proposals that were submitted? Or does that depend on the country that you submit them in?
Okay, maybe I'm not the more titled to reply to this question, but I ask colleagues maybe from Work Package 7 if they have some figures to share with us.
Mm-hmm. That's okay if you share them later on in a follow-up of the webinar. That's fine as well. If you don't spend time on it right now with so many people in the call, that's fine.
Yeah, yes, and also, by the way, in the impact assessment of the call that you can find if you follow the QR code, and on our website, you're going to find the figures for the JTC 2023.
Okay, thanks.
Yes, maybe I could add the fact that this webinar is dedicated to the 2025 call for proposals. So we didn't prepare slides or statistics for the other calls of 2023 and 2024. But in general, funders prepare statistics also. But if you wish, we can prepare something in common, and then we could upload it on the THCS website in the future. Would it be fine for you? Okay, thank you. And Federico, there is one question in the chat. I will read it to you. Is it possible for projects to use resources in work packages in the other pillars? Example, does the partnership have expertise in engaging relevant policymakers that we could use in projects? In such a setup, the projects would provide the content for policy advice, but THCS would help us get that advice in front of relevant policymakers. Therefore, projects wouldn't have to devote resources to mapping out where that advice should be directed. Do we have the answer for this?
Okay, maybe also this, I can try to reply, and maybe colleagues from work package 6 and 7 can jump in. But I guess this cannot be foreseen or done before your project is submitted. After your project is submitted and eventually selected, in that case, we can foresee some synergies in between the funded projects and specific work packages of THCS, but I don't think it is possible to foresee this kind of synergies already in the application phase.
Yes, Justine?
Yeah, I could chime in just to add that in general, applicants will be expected to provide some perspectives on how they will reach their relevant stakeholders and involve the relevant stakeholders. So there's certainly not a sort of blanket, the THCS deals with the stakeholder side of things. The proposals will be expected to do so. However, there are initiatives, in particular the annual conference, so once a year there's a conference where the funded projects are invited to come present their projects and their results later on. And that is one opportunity to get in touch with relevant stakeholders.
Thank you very much, Justine. Maybe one more question. Hi, you showed the map of the THCS partnership, but we have seen that not all the countries are participating in 2025 call. Will you please tell later which kind of organizations from which countries are eligible? Federico, would you like to reply?
Yes, or Justin, I don't know.
Yes,
yeah.
there will be a slide in my presentation on which countries are participating in the 2025 call.
Okay. In this case, that's great. Thank you very much, Federico. And you can keep the floor, Justine, so that you can explain to us the call text. Thank you very much.
Thank you very much, Maria. So my name is Jostein Holmgren. I represent the work package in THCS that has the responsibility for drafting the call text and the other call documents. I also represent the Research Council of Norway. And together with my colleague Siv Øverås, we are leading the work package that conducts this work. And it's my pleasure then to present to you the Joint Transnational Call for Proposals 2025 titled Better Care, Closer to Home, Enhancing Primary and Community Care. So I'll immediately get to the question I was mentioning in chat just a moment ago, which countries are participating. So for this call, there are 22 different countries participating. You can see those in the map and in the list. And in addition to the European countries that are participating, we also this year have Canada joining as a partner to the call. From these 22 countries, there are 34 funding organizations. So that means that for some countries, there are more than one funding organization. That could be representing different regions, and that could also be representing different types of research and innovation funding. So it might be an organization representing, or one organization might fund only research, and one organization might only fund innovation actions. So it will depend on your project, which funding organization applies to you. The total budget of this call is approximately 35 million euros. And this is a call that is co-funded by the European Commission. For you as applicants, that has little practical relevance because you will be receiving your funds from the funding agency that applies to your country or region. But what that means is that the European Commission is participating with 30% of the funds that go into funding projects for this call. Now, moving on to the topic of this call. This call is really focused on two sectors of health and care, which is primary and community care. And to strengthen and enhance these sectors and to provide policy and decision makers with the necessary knowledge and tools to govern the transition needed in these sectors to meet future demands of health and care. And this within the broader scope of THCS, the ultimate goal is to improve health and care system along several dimensions, including quality, efficiency, equity, and sustainability. So your project may try to address one or more of these dimensions. So this call really builds on a few foundational principles. One is that the care delivery should be done in the setting that's most appropriate, both for the users, the patients, and also the caretakers. And that new or improved health and care models need to rethink from the ground up how the delivery, organization, financing, and distribution of these health and care services are done. One of the really foundational and core principles of THCS is called transforming health and care systems, is that health and care systems should not simply be iteratively improved in order to meet future demands. There's someone has the microphone on. Okay, I think we're good. So it's not simply to iteratively improve on our health and care systems in order to meet future demands and to improve health and care for the future. The health and care systems in of themselves need to transform quite radically. So for this call, we are looking at a trend in European health and care where there's an over-reliance on institutionalized care. And in the context of this call, what we mean by institutionalized care is care in a institution such as a hospital or a care home or a mental health institution or other institutions where you are admitted and you stay in the institution at least overnight, but potentially also much longer term than that. These kinds of health and care institutions are certainly important and necessary, and the intention is not that we will not have such institutions, but patients that can be treated outside of these institutions should be done so. And the reason for this is that these institutions have really high personnel and costs barriers in order to meet future demand. Simply put, if knowing what we know about the population trends and the amount or the number of health and care professionals that are and will be available, these kinds of institutions will not be able to meet demand if we follow the current model of care. However, there are many barriers to moving health and care out of these institutions and into the primary and community care sector. And it's not necessarily that it's not possible to give adequate and high quality care in these settings, but it's rather that there are outdated organizational models and infrastructure that doesn't facilitate care in these settings. There might also be limited resource capacity, both financial, but also in terms of the skills and competences of health and care professionals. There may also be inadequate or outdated funding and reimbursement models that incentivize institutionalized care over non-institutionalized care in some European contexts. And finally, there are policy and legislative obstacles where there's no clinical or health and care related reason why a patient might not be able to be treated in the primary or community care setting, but there are policies or legislations that prevent that from happening. So from that backdrop, the aim of this call is to enable reduced reliance on institutionalized treatment, and proposals should strive to develop service innovations that promote the transformation of the health and care system away from these institutionalized treatments and towards treatments in the primary health and care sector, and also in your local communities. The call is divided into two subtopics. Subtopic 1 is titled Strengthening the Primary and Community Health and Care System. And this subtopic is really focused on research and innovation and developing new service innovations that directly address the barriers and the challenges that prevent health and care systems today from moving in this direction. So proposals may concern either organizational innovations, operational improvements, or human resource innovations. By this, we mean, by organizational innovations, we mean things like service models, models of care, these kinds of health and care service innovations. For operational improvements, that can be technological advancements. So you can include elements of technology development, but it could also be developing funding instruments and other tools and more practical innovations that improve the operational qualities of these sectors. And finally, human resource innovations that relate to ensuring that the primary and community care sector has the required human resources, both in terms of quantity, but also in terms of the skills and competences of the human resources necessary in these sectors. And for this subtopic in particular, it's important to consider the entire value chain from idea generation through the development of your idea, and also crucially in context of THCS is to have a really clear idea of how your idea, how your innovation will be implemented into the health and care system. The second subtopic is titled Systemic Approaches to Modernizing the Primary and Community Care Sector. And this subtopic really applies to giving policy and decision makers the necessary knowledge that they need in order to facilitate this transformation of the health and care system. So they will need evidence and practice-based knowledge. And this may be in the form of policy development, it may be in the form of change management or strategic planning. Proposals can approach this in many different ways, but they may, for instance, recommend how to implement or transfer best practices at various different levels, including political, administrative, and management levels. And they may also develop guidance on designing and implementing reforms in the relevant context of the primary and community care sector. So if I were to boil down these two subtopics, the subtopic 1 would be about innovations, and subtopic 2 would be about knowledge generation that informs policy. So there are several essential elements that proposals should have, regardless of which subtopic they address. All proposals should aim at collaborative transnational research, innovation, and assessment actions. Proposals must include one or more of the following: applied research, implementation research, piloting, upscaling, and/or testing. All projects must show a proof of concept or validate solutions and demonstrate them in the relevant health and care settings. This also includes translating existing solutions to new settings. Now, just lingering on this point for a moment, in the context of THCS, and one of the core principles of this partnership is that the project outcomes are actionable and they are applicable in the short term. So successful proposals have a clear strategy for how the results will be implemented in the relevant context and involving the relevant stakeholders. Next, proposals, they may involve technology development or organizational models related to new technologies. However, these must target technology ready levels of 4 to 8. That is to say that technologies need to be relatively mature, and the projects also can't primarily be about technology development. The technology development may be an element, but the it can't be the main focus of the proposal. Finally, proposals must be original, but they can build on or not duplicate existing EU-funded activities. That could be joint actions, aeronets, and so forth. Finally, from me, there are some criteria that will lead to your proposals being rejected. The first one, as I just touched on, is that if the proposal predominantly concerns development of new technological solutions, that is TRL levels 1 to 3, and there's no focus on the integration of solutions, organizational models, or implementations in the health and care systems. Secondly, if there's a predominantly clinical, preclinical, or biomedical component. 3, if there's solely epidemiological studies that do not focus on the solutions, models, or implementations of these solutions in the health and care systems. 4, they relate solely to welfare services and do not address issues related to health and care services. And then finally, for point 5 and 6, I encourage you all to see the auxiliary document to the call text, the guidance for applicants, because these relate to how that your project needs to take into consideration the ecosystem-wide approach. And we have a quite thorough example and outline of what this means for proposals in the guidance for applicants documents. And this also relates to failing to consider end users' perspectives. These two are related points, and they're all both covered in this guidance for applicants. And I highly encourage you to have a look at this document. That is all from us in Work Package 6. So I'm going to take some questions and then hand off to the Joint Call Secretariat.
Thank you very much, Jostein. We have one question. So regarding topic 1, where the proposal should cover idea, development, and implementation, what is the expected degree of implementation? Should the proposal demonstrate actual implementation, or should it suffice to present the idea of how the implementation would be carried out?
So because these are research and innovation funding, there are limits to how far in the value chain we can fund proposals. That means that we cannot fund the actual implementation itself. That would move into procurement, which is outside of sort of the legal scope of what research and innovation funding can be used for. So it is the former, that is to say, we expect to see clear strategies for how your results will be implemented in the relevant contexts, but we do not expect the results to be already implemented by the end of your project.
One more question. Can a project leader in one project also participate in another project under the same call?
I think this is a better question for Work Package 7. Michael, do you remember? This is addressed in the call text, so I can look it up if need be.
So maybe I can reply the fact that when we have a project leader, this one will be the coordinator of the project, and he or she can also he cannot participate in another project as in the same call for proposals. But if you are not coordinator, but you are a simple participant in the call, you may participate in 2 projects, for example. So maybe at this point, I can give the floor to Michael, who will present us the procedure and the criteria of the call, and then we will come back to all the other questions.
Okay, hi everyone. Let me know if you can see my screen. I guess so. Maria, could you confirm?
Yes, I can see it. Thank you.
Cool. Thank you, Maria. So first of all, I'd like to apologize. Not only I'm French with a French accent, but I also have a cold. So I'm speaking through the nose, so I hope everyone will be able to understand me. So now, since you have dived into the core topics 2025 with Josten, let me guide you through the submission and evaluation process of this call. And first of all, I'd like to start with the following table, giving you an overview of the process. So this year, THCS is implementing a two-stage call. And for those already familiar with THCS calls, unlike the previous years, we will have a first evaluation and selection of projects based on scientific evaluation, and that will result on a first batch of projects to be selected and invited to submit a full proposal. And as you can see, the process span over a year, notably accommodating the summer break and granting enough time to the reviewer to assess the proposals. But also, we, as a call secretariat, need to coordinate the call management with the other funding organization participating in the call, under the entity of what we call the call steering committee. So we have to meet and to validate and agree on the scientific evaluation. So as you may know now, the call is open. The first submission deadline for the proposals is January 30. After this deadline, we will perform an eligibility check on one end at the central level of THCS, according to the THCS criteria I will talk about later. And on the other side, on the other hand, an eligibility check performed by the funders, by the funding organization, according to their own national regional regulation. So once this eligibility check is performed and validated, the proposals will be shared and sent to the reviewers for a written evaluation phase. And at the end of this written evaluation, the expert will meet in a committee, in a peer review panel, where they will discuss all the proposals and they will establish a ranking list. Right after this meeting, the funding organization will meet under the call steering committee to select based on the scientific evaluation and also actually based on the budget available. They will decide which proposals will be invited to the second stage. So applicants will be informed by the call secretariat whether or not they're selected for stage 2. So again, you will be asked to apply for a full proposal submission, and the deadline is June 19. Once again, we will perform an eligibility check, followed by a written evaluation. And by mid-August, applicants should expect some feedbacks from the call sec with a comment from the reviewers about their review and their comments on your application. So you will have the opportunity to reply to these comments if needed and to clarify certain points if necessary. That's what we call the rebuttal. So by mid-August, you should get some news from us and provide some new insight to this review. So at the end of this second written evaluation phase, a PRP meeting again, a peer review panel will take place in September, again to discuss all the proposals, to establish the final score for your proposals and to establish a ranking list. Following this meeting, your proposals also will be evaluated, taking into consideration ethics. So there will be an ethics evaluation. and only proposals with ethics approval will be considered for funding. And following these steps, actually, the call steering committee will meet again to finally decide which project will be recommended for funded or not. You will be informed by the secretariat of you will be informed of the decision by the call secretariat, and at the earliest, you will be able to start the granting arrangement with the relevant funders in December. So now, regarding the central eligibility criteria at the THCS level, the minimum project duration is 12 months and the maximum is 36 months. Applicants could be from academia, from the clinical and public health sectors. They could be companies or other operational stakeholders such as patient and citizen organization, NGO, local communities, municipalities, and so on. But you will also have to check with your relevant funders if you are eligible. In some cases, some funding organization could not fund, for instance, companies or patient organizations. So you have to check in the call text if you are eligible or not, and you are strongly encouraged to contact your national contact point to be sure you are eligible. Also, in some instances, some funding organizations require the participation within the same consortium from an academic partner and an implementation partner. So you have to check this regional national criteria. Additionally, the minimum size for a consortium is 3 partners from at least 3 different countries, with at least 2 countries from EU member state or associated countries. And the maximum number of partners is 9. And in addition to these 9 partners, you can add actually two partners participating with their own fund. So we call them collaborators. And one additional thing is only 2 partners from the same country are eligible. Also, in addition to that, a PI could only submit up to 2 proposals. So it could be 2 proposals as a mere partner, or it could be 1 proposal as a coordinator and 1 proposal as a mere partner. But you cannot submit 2 proposals as a coordinator. And finally, again, contact and check the eligibility criteria from your funders, because some additional documentation could be required at the national, regional level, and you will need to submit additional documents directly to them. Now, regarding the eligibility cost, from the THCS point of view, from the European point of view, you can request funds for personnel, for consumables, for equipment, for travel, for other direct costs, and for subcontracting. And you also have to indicate the overheads required by your funders. And again, you have to check if all these eligible costs at the European level are eligible at your regional, national level. Also, while the participation of enterprise are strongly encouraged, the EU prohibits the funders from granting aid to enterprise in difficulty. So each funders will need to conduct check to ensure that your enterprise is not in difficulty. So please contact your funding organization as soon as possible to understand how and when you have to start the process of this specific check. And now, related to one question also I saw in the chat. So double funding is not a law. It's not a law within THCS, but it's not a law among EU program or even between EU program and national program. However, if you previously submitted a proposals, you can still resubmit the proposals in this call, actually. And now I would like to outline a few considerations for submitting a successful proposals. So we expect the project to have a significant impact on how health and care systems are organized and how healthcare services are delivered. And to reach that ambition, we believe that consortia should bring diverse expertise. So that starts by bringing a different perspective from different stakeholders or from different type of applicants, from academia, public health, from private sector, or from the operational stakeholders. But in addition to this multidisciplinary for each of these, in addition to that, multidisciplinary for each of these categories are also important. So I'm thinking, for instance, about the public health sector. Complementarity between hospital and community and primary care are important, and it should be reflected in your composition of the consortium. Well-being and social care services, general practitioner, our medical society, and so on are also invited to participate in this in your consortium. When referring to academia, consortia could also bring expertise from public health research, from humanities and social sciences, from bioinformatics, technology, digital health, healthy research, and health economics, and so on. Also in the private sector, of course, we anticipate the participation of enterprise to implement, for instance, a digital solution, but we are also thinking about the regulatory authorities, about the payers, or also HTA agencies. So finally, we also truly encourage patient organizations to be included in consortia as partner, ensuring that the projects are grounded in real-world experiences, leading to more relevant and impactful outcomes. However, we understand that some stakeholders could not directly participate as partner in a consortium, such as policymakers or health insurance providers. But we strongly encourage you to include their perspective through different consultation, for instance. So you can lead some discussion concerning the planning, the realization, and the implementation of your project. It could also concern the dissemination activity or the utilization of the result of your project. And last but not least, but since we are aiming to have better access to healthcare system, we also expect that your project will consider gender dimension as well as socioeconomic disparities and underrepresented population. And of course, if those are important considerations to have in mind when you are writing your proposals, it is because those aspects will be assessed accordingly. So there are three main criteria. an excellence criteria, an impact one, and the last one is quality and efficiency of the implementation. So all the three criteria are weighted equally, and in excellence, reviewer will, of course, assess the soundness and the relevance of your project, and will consider the ethical consideration I just mentioned, and and also how you consider the different engagement of different stakeholders. Regarding the impact, this criteria will focus on the credibility of your pathway, of your solution, of your strategy, and how your solution will be able to improve health outcomes, or will be able to deliver a better healthcare system, better access to the healthcare system, how your project could be sustainable, and finally, but not least, how your dissemination is effective and could influence the policy development, and the healthcare delivery. And finally, the last criteria regarding implementation, it is more focused actually on the work plan, on the monitoring, on the management of your consortium. So we will the panel will check the robustness of your work plan. We'll check the multidisciplinary of your collaboration and how you manage the risk and the management of your consortium. And as I said earlier, following the scientific evaluation, an ethics evaluation will be performed by a dedicated ethics board. And basically, applicants invited to submit full proposals will be asked to fill self-ethic assessment. So it is mandatory to fill it, and the ethics board will use this self-assessment to evaluate your proposal. So the ethics board could either grant ethics clearance, then your project will be considered fundable, will be considered fundable. They could also grant conditional clearance, and then the ethics board can require additional information or additional measure to be implemented in your work plan. And finally, a no clearance status will result on your project to be not considered for funding. Now, regarding the submission process, so you will have access to the submission platform. Once you reach this page, you will be able to sign in for the first time to the platform. And once you fill all this first information, you will receive by email a validation code, and you will be able to apply for and fill your application form. So in the next page, you will be able to create a new proposals, and once created, you will see the list of your project, your proposal listed here in these pages. Then you will land on this page, and basically you will be asked to fill some general information regarding the title of your project, the acronym, the keywords, the summary of your project, and yeah, mostly that for this part. And in the following one, you will be able to add partners and collaborators to your project. And the good thing with this platform is you can actually invite your partners to sign in this submission platform and to fill by themselves their participant details and their financial plan. The coordinator could also do this, but you can do this collaboratively by asking your partner to do it. So, and then you will have this project description step where you will be asked to actually upload your applications that you can see here. So you can find this application form on our THCS website, but you can find also this application form in the submission platform. So basically what we're asking you is to fill this form including all the project descriptions, the work package, and so on, to then make this Word document into a PDF and upload this document into the platform. And you will be asked to upload also the signature of all the participants and additional annex also that are required for collaborators, for instance. And finally, just to close the loop, you can find again the different timeline I show you at the beginning of this presentation. And you can contact us in case of questions. So more info on our website and on LinkedIn. And you can contact us by email at thcs@ana.fr. And now if you have questions, I'm inviting also the other partner from the call secretariat to take the stage. And we will be delighted to answer your question before moving on to the next session. Thank you.
Thank you very much, Michael. So we had a lot of questions, but most of them were already covered either by your PowerPoint or by giving the reply from the colleagues. So maybe I can ask you one or two questions of those. So the first one, does two partners from France and one partner from Canada respond to these criteria?
So, fair question. So actually, in this specific case, you will not, because Canada is not a EU member state or an associated country. So you will need. I'm sorry, I'm hesitating now. It will.
Justine, maybe you can give us your opinion.
No, actually, I can start in even simplest way. But if there is only France and Canada, it won't follow the criteria of the call. So you need at least 3 different countries participating in the call. So you will need one more country for this consortium.
Okay, thank you. Do all the coordinators need to be in affiliated countries, or a minimum number of coordinators from affiliated countries and others can be from outside these countries? Maybe this question is referring to the participation of collaborators.
Finally.
I think I can respond to that. So you can have up to 2 self-funded partners that we term as collaborators, and they may be from any country or region. We have no regional restriction at all regarding that. So that may also be outside of the regions that receive funding from THCS. However, you need to have at least 3 partners from a minimum of 3 different countries that do receive funding from a THCS member. But that doesn't have to be an EU or associated country. That also includes Canada, for instance, or Israel or Switzerland, that are not considered associated countries, but they still provide funding in the call.
Okay, thank you very much. I also see that we have a lot of messages concerning the partner tool. So maybe we can give now the floor to Marcin, Marcin Simileski, so that you can demonstrate us the tool we have, and then we will continue with the other questions.
Yes. Hello, so my name is Marcin Chmielewski, and I'm representing the Joint Call Secretariat. I would like to give you some information about our partner search tool, which is called Pathfinder. So this tool is completely optional. It's not necessary to use it if you want to apply in the THCS call, but it can help you to find partner or to find a consortium if you are looking for one. So these are major aims of this tool. So we created this Pathfinder to make the life of research team easier, and we trying to keep this tool as simple and easy accessible as possible. And the major feature of this partner search tool is that it allows to any user to post its announcements and also to view the announcements, and also to filter them by any or different set of keywords or filters. And also our new feature, you can also send a quick message to author of interesting announcement in the form of a chat. So this option is also available in this year. So the main page of the search tool is like this. So if you go to pathfinder.ncbr.gov.pl, you will see this page, and on this page you can see the announcements. You can go through them, check the authors, check the titles and brief descriptions, but it is in some way restricted. Also, we can filter this database by many different filters, like type of collaboration, announcing country, status, classification areas, keywords, partner types, and also by program or call. So if you're interested into finding THCS announcements on THCS projects, so please remember to check this or to pick this filter. And this is pretty much everything that you can do without a login, because due to data protection regulations, you need to create a login to be able to see the details of the announcement and to create your own announcement. So to do this, just click on any of the buttons that are visible here. So like new announcement, your account, or details on any of the announcement, and you will be redirected to this page. This page is a screen when you can log into your account. If you don't have a login yet, please check the option register. The registration process is very simple and very easy. Only the email and password is necessary, and also you will receive an activation email on your email address. So please remember to check it. If for some reason this activation email won't reach you, so please contact with our help desk, so we will easily help you. We have an ability to activate your account remotely, so it's not a problem, and we can do this in minutes. And yeah, there are some different reasons, and in some cases the activation link or activation email just didn't reach. So please remember that we can help you. So after you create your login, you will see the page again, but it will be a bit different. You can see more different buttons, especially in the announcements. You can see the details, follow, also report violations, so this flag button, and also chat button. So you can press any of them to take an action. And also you can manage your account. So if you press the your account button, you will see your profile, your messages, so your chat, your announcements that you created, your followed announcements, so announcements that are your favorites. And of course, you can change the password and your email. Yeah. The most important button in this on the screen is a new announcement and also most important feature. So you can create your announcement. If you press it, you will see this screen. So this is the announcement creation form, and here you can put the information in the way you want. So please prepare it that it will be the most sufficient way for you and the most beneficial for the viewers. And when you create the announcement, please remember to go to My Announcements page, because in this page you will need also to publish this announcement, because if you create it, it will still be in a ready status and it will not be yet visible for others. So only through this page and checking the Publish option or Publish button, you will make this announcement visible for others. So it will be visible on the main page, and everyone that is interested in collaboration with you will see it, and will be able to start a chat or send you an email. And also here on this page, you can edit your announcement, you can cancel them, you can prolong them, you can withdraw them, remove them, and do anything that you want. And here you can see only one of them, but in time, when you create more announcements, they also be visible here. And also the page with the favorite announcements is very similar, and there you can only remove them from the list. But also you can check the details if you're still interested in this announcement. And the almost last option is the chat button. So if you started a chat with author of any of the announcement, you will see this screen. Here you can see the chat with the authors of interesting announcement. And please remember that you are chatting with the author, but only in a specific announcement. So you can have few different chat with the same author. That means that this author has few different announcements, and they're all interesting for you. So you can just continue few different chats with the same person as well. And as I said at the beginning, if you have any problems, you can, for example, this activation email won't reach you, or for any other reason you will be not able to create your account, please write an email to partfinder@ncbr.gov.pl. So we will help you. We can do pretty everything with the system from our point of view, so it's easy to help, and there are no restrictions in that. So thank you. That is all I wanted to say.
Thank you very much, Marcin. Please, do you have questions on this part of the presentation? Please, Abba Samar, you have the floor. Abba Samar, can you hear us? Okay, so I think no, it's okay. And I don't see questions for this part of the proposal in the chat. But we have a lot of partners asking for collaborations. So you will have this opportunity to have more information on our website. Maybe just to tell you that the questions we received in the chat where almost all of them are replied, except for some of them. In any case, the questions we see in the chat are concerning the call text, and the call text is published online, so you have access to the call text and you have access to other information, for example, to the timeline of the call. Maybe I can take 2 or 3 questions for the moment, and if you want to ask something, of course, you can use the raise hand function. For example, this could be a question for Michael concerning ethical approval. Should we get ethical approval before the funding? Does the ethical authorization need to be granted by the time of proposal submission, or it can provide it later in the process?
So actually, the ethics evaluation will be performed by the THCS consortium with a dedicated ethic board. So you need to demonstrate that you have all the requirements to proceed with your project, complying with EU and national regional legislation. And you could be asked to share with us this requirement later on after your project is selected for funding. So you will receive probably a conditional clearance, and you will be asked to provide us the needed information documentation later on.
Okay, thank you very much. I see one more question concerning the annual conference. Regarding the annual conference, how are those funded? Can we add costs to attend to budget? Federico?
Sorry, can you repeat the question, please?
Yes, the question is regarding the annual conference, how are those funded? Can we add costs to attend to budget? Maybe we are asked if the coordinators we invite to the annual conference, are their expenses covered by the partnership, or they should plan those expenses in case they would be invited during the submission of the call?
Okay, I would say that maybe this is really too early to say this. First of all, you need to apply, then you need to be selected, and then in case this will happen for the annual conference 2026, most probably. So it's way too early maybe now to discuss this point.
Thank you very much. I see that one participant would like to have the floor. Yes, please. I'm sorry, I can't read your name.
Okay, is it me?
Yes, that's right.
Okay,
thank you very much.
I'm sorry. Yes, thank you very much. My name is Diane. I'm from Israel. I was wondering if you could maybe briefly mention something about the review process, the selection process. Maybe just very quickly, something about the criteria or the length of time that it would be taking. And if it's on the website, then you can just refer us to the website. Thank you.
Thank you. So, Michael, would you like to say 2 words on that, or you prefer that we can elaborate it in the FAQ?
I think we can find also the info on the slide we will provide, and on the recording we will share with you. But basically, this is a 2-stage call. The peer review. This is a peer review process. So we will have a committee of experts covering all the expertise needed. They will provide some written evaluation, and will meet online to discuss all the proposals. They will decide on a score for your proposals and establish a ranking list. And based on that, the call steering committee will decide which proposals will go on stage 2 and which proposals will be selected for funding according to the scientific evaluation and according to budget availabilities. What else? There are 3 main criteria: excellence, impact, and the quality of your implementation. So yeah, the soundness and robustness of your project and the quality of your consortium, in a few words. But you will find all this info in the call text and on our slide from today.
Thank you
so much.
Thank you. Thank you very much. I see that all the other questions have been replied in the chat, either through the chat or through our documents and our slides. Do you have another question concerning all the presentations and a question that is not presented in the chat, so as not to repeat ourselves and give floor to what we haven't discussed yet? So I will see. Okay, now Ms. Rare, please. Naomi, can you unmute yourself?
Hello?
Yes,
Do you hear
yes,
me now?
please.
Oh, thank you.
Yes.
So first of all, I would like to thank you. It's very helpful, all the information, and I hope I will get back to it. My question is whether an associate country, a representative from as a researcher from an associate country can be a coordinator, or only EU member.
Okay, thank you.
Thank you.
Thank you. Who would like to reply to this question?
I could reply. I'm just getting the relevant section of the call text in front of me just to make sure that I'm stating this correctly. So there is not a criteria. There's not a rule. Oh yeah. So the project coordinator must be eligible for funding by one of the funding organizations in the call, but it does not have to be a EU member state or associated country. So that would mean Switzerland, for instance, would be or partners from Switzerland would be able to be project coordinators.
Thank you very much.
Thank you.
Now, Ms. Rare, can you please?
Finished.
Oh, it's you. Okay, thank you. Amira Rasha, do you hear us?
Yes, yes. Hello, and thanks
Hello.
a lot for a nice presentation. Sorry, I asked already the question regarding if a project leader can be a part of another project, and you mentioned it no, but in one of the slides it has been mentioned that a project leader can be also a partner in another project. Is that like based on the institution of the project leader, or how it works? Because it's not clear for me. Thanks.
Okay, thank you. Who would like to reply?
Pardon, I was responding to a question in chat.
Yes, and for me.
Could you repeat the question, please? Apologies.
Okay. Yeah, the question is about the project leader. If a project leader of one can be part of another project.
So the coordinator can be part of another project, but not as you can't be coordinating two projects.
Okay, yeah, thanks.
Thank you very much. I try to see in the chat if we have other questions to reply right now. So yes, please, Brita.
Yes, hello. Thank you for the possibility to ask questions. I have a question about. I have a question about the topics. It says the call says health and care, but it sounds to me that it has a lot of focus on health, not just care as social care. So I am curious about to what degree the call opens for projects that involves social care.
So we quite explicitly throughout the call text use the terms health and care throughout, and that's to make explicit that this is not a call or a partnership more broadly about just healthcare. So social care would also be covered. The only limit is that if the proposal only applies to welfare, it is not covered. But social care would be covered.
Okay. Thank you.
Okay, thank you very much. We have a question like, will this chat be available or downloadable? So as we said at the beginning of the webinar, we will take all your questions, we will reply to them, and then we will create an FAQ on THCS website. So all your questions, if there are already some of them not replied, you will have the replies in a few days, so no worries on that. Would you like to have the floor? I think that someone is unmuted. Would you have a last question? So please, you can raise your hand. Yes, please, Thorsten.
About the chat. The discussion is that there's a lot of people connecting with each other, and I don't think you will take that into the question and answers. So the chat was so people can reconnect. So if you could please save that.
Are you referring to our chat, or to the fact that some of the researchers are searching for partners?
Yes, a lot of people are searching for partners in the meeting chat.
Okay. In fact, I'm not sure that we are permitted to put that online, but of course, as we have demonstrated our tool, if you are searching for partners, please use our tool. You have all the information on THCS website, so please don't hesitate to use it. In the FAQ, we will upload, you will have questions and answers on what you have already put it in the chat, but I don't think we are permitted to put the information of the researchers who are searching for partners. So please, you can use our partner tool.
Maria, just to add
Yes.
to that, the chat for everyone who's joined this meeting, the chat will remain available in your Teams application. So you will be able to go back to the chat after the meeting is closed.
Okay, great. Great.
Thanks. That was the answer I was looking for. Thanks.
Do you have other questions?
Just a question. For collaborators, because we have checked that our funding agency, we are a small and medium enterprise, so we cannot participate as full partner. So we should go for being collaborators. So in European projects, there are these associated partners. Sometimes they participate in the project, and other partners, let's say, pay for them even a small amount, but cover their expenses with their own budget in some way, maybe with indirect cost or whatsoever. So I was just wondering how it can work with this call about collaborator. Is there any way to? We know that these are like self-funded, collaborators are self-funded following the call, but is there like a way to, let's say, to support them in some way with the funding available?
So this will vary between funders. So I highly recommend that you contact your national regional contact and ask them what would apply to you. Some organizations I know do allow for this kind of subcontracting or under certain conditions, but while others don't. So there's no one simple answer to that, I'm afraid.
Thank you very much.
Thank you. Jordi Tolura.
Yes, thank you. I would like to ask something more general, as the call is for research and innovation projects. Can you please clarify how much research or how much innovation, both concepts, in which way they are important?
Certainly. So that will vary a bit from project to project what is appropriate. There's no overall distribution of how much should be research, how much should be innovation. It should be appropriate to your project. The only thing I will say is that THCS as a partnership and this call included is focused on the project outputs. It must be actionable and have a short path to implementation, whether that is research or innovation actions. That will depend really on your project what that means for you. But for this particular call, in very broad strokes, the first subtopic is more oriented towards innovation actions, and the second subtopic is more oriented towards research actions. But that is, again, very broad strokes. But certainly both are within scope of the call, and certainly you can have a combination of both in your project.
Thank you. Wala Jaser.
Hi, thank you. Just to double check that we understand. So we're based in Switzerland, and Switzerland is listed as one of the participating countries, right? So if we have ourselves from Switzerland and one EU partner, that's already satisfies the two requirement of collaborating countries, and then we can have a third non-EU or collaborating partner. Is this true? Or do we still need to have 2 EU members and ourselves?
So you would need to have 2 EU members and yourselves.
Okay.
So the requirement is there has to be at least 3 partners from 3 different countries that participate with funding. So Switzerland would count as one of those 3 countries, but there also needs to be 2 countries or two members from either EU member states or a Horizon Europe associated country. And since Switzerland is not part of that, you would not count as one of those 2. So for your example there, you would need 1 additional EU member state or a Horizon Europe associated country in order to be eligible.
Okay, perfect. Thank you.
Thomas Gargaud.
Yes, thank you for this time of questions. I had a questions about patients' associations involvement. Is it possible to ask funding as a patient association to do meetings, to do trainings, or be involved in the writing on the projects? Is most of them are benevolent, or what could be over involvement of patients and associations to improve implementation?
So they could, please go ahead.
No, go ahead.
They could either participate as a true partner and request fund to a specific funders if these funders allows participation of patient organization, so they can be directly involved by requesting funds to a specific funder. They could also participate as collaborators, participating with their own fund. They could also be included in the project by being consulted for different stage. But related to more specifically to your question, you have to check with your funding organization to know if these costs are eligible or not. So please contact us, I guess.
Thank you very much for your answer.
And we can take two last questions. So Oscar Johnson, please.
Yes, thank you for an informative webinar. And my question concerns the topic. And we believe that the housing sector plays an important role in the closer to home health and care system. So my question is the housing sector and or built environment part of the scope of this call?
Without knowing the details of exactly what you're referring to, I think that it will probably fall under what we in the call text term as technology development. I assume because I assume you're referring to some sort of technology development in the housing sector, and that can be part of a project, but it should not be the main focus of a project. So because this is a partnership and a call about health and care services, so it should be health and care service. Research and innovation is the main focus, but you can have technology development as a part of that, and certainly then the housing sector in terms of home-based care would absolutely be within scope there.
Yes, thank you for your answer.
And the last question, I'm sorry I can't read your name, but you have the floor.
Thank you so much. Yeah, I'm from a pediatric hospital from Israel. Just and we've put special focus regarding home care, but as a hospital, and since we have kind of a unique healthcare system and a health management organization, this is made possible. But from the perspective of a hospital, is it possible for me to apply with the kind of valid and appropriate partners?
So this, in general, research hospitals and hospitals in general, clinical partners can apply to this call. I do not know the specifics for the Israeli funder, so you would need to contact your Israeli funder to ensure that they in fact also cover hospitals. But in general, yes.
Thank you.
Okay, thank you. So please, Fabio Feudo,
Yeah.
it will be the last question.
Thank you very much for allowing me to put this question. Maybe you already touched this point, but I really did not understand. The topics, the proposal are funded at 100% or 70%. This is very important to know for us. 100% or 70%?
But from on the transnational level, there is no restriction. So that is to say, it could be up to 100%. However, each funding organization will have their own rules for the partners that receive funding from them. For some, for a lot of partners, academia, hospitals, public sector are eligible up to 100% in general, but there may be exceptions to that. For companies, they will always have some requirement of co-funding because all the companies in Europe are covered by the state aid rules. So for them there will be a limit. But again, you would have to refer to your national regional funder to get the specific rules for you that apply to you.
Thank you very much indeed.
So thank you very much for your participation in this webinar, for being here with us today. As we told you, you will have the FAQ uploaded in a few days. You will have all the questions and the responses in this FAQ. And of course, don't hesitate to contact the funder from which you would like to ask funds in the frame of this call, because your funder can also help you take the right decision or reply to some points which may concern only funders specifically. So thank you very much once again, and we wish you a nice evening. Thank you.
Thank you. Bye-bye. Thank you.
Bye-bye.
Thank you. Bye. Bye-bye.
Thank you, everyone.
Thank you. Bye-bye.
Thank you. Bye.
Thank you. Bye.
Bueno, yo bastante. Yo tengo aquí todo el documento traducido. Pero tengo que, porque